Good evening, everyone. I'm a transfer student of the St. George's University, and I'm doing the One Health, One Medicine course. This evening, my presentation will be on hepatitis B. To begin, hepatitis B is a viral infection that is spread through contact with body fluids, such as blood, saliva, and semen of an infected person. As a little background or history of hepatitis B, the earliest record of an epidemic caused by hepatitis B virus was made by Lerman in 1885. An outbreak of smallpox occurred in Bremen in 1883, and 1,289 shipyard employees were vaccinated with lymph from other people. After several weeks and up to 8 months later, 191 of the vaccinated workers became ill with jaundice and were diagnosed as suffering from serum hepatitis. The virus was not discovered until 1966, when Baruch Blumberg, then working at the National Institute of Health, or NIH, discovered the Australia antigen, later known to be hepatitis B, in the blood of an Australian Aboriginal person. Hepatitis B statistics. Hepatitis B is 100 times more infectious than the AIDS virus. Yet it is preventable with an effective vaccine and treatable with effective medications. For the more than 240 million people worldwide who are already chronically infected with hepatitis B, the vaccine is of no use. More statistics of hepatitis B in the world. Approximately 2 billion people have been infected, and that is 1 out of every 3 persons. 240 million people are chronically infected. Between 10 to 30 million will become infected each year, and up to 1 million people die each year from hepatitis B and its complications, such as liver cancer. Types of hepatitis B. Acute hepatitis. An acute infection may last up to 6 months with or without symptoms, and infected persons are able to pass the virus to others during this stage. Chronic hepatitis. The risk of developing a chronic hepatitis B infection is directly related to the age at which one becomes infected with the virus. 90% of infants exposed to the hepatitis B virus will develop chronic hepatitis B infections. Transmission. Basically, the virus is transmitted through blood and infected bodily fluids. This can occur through direct blood-to-blood contact, unprotected sex, on sterile needles, from an infected woman to her newborn during the delivery process. Some signs and symptoms are dark urine, joint pain, loss of appetite, fever, abdominal discomfort, weakness, yellowing of the eyes and skin. Some of these symptoms are so similar to the flu that persons may even misdiagnose and think it's just the flu. Diagnosis. Doctors can usually diagnose hepatitis B with routine or requested screening tests. Some reasons a person may need screening are if they have come in contact with someone with hepatitis B, have traveled to a country where hepatitis B is common, use drugs, receive kidney dialysis, are pregnant, are men who have sex with men, have HIV. Some of the high-risk groups of persons: healthcare workers and emergency personnel, infants born to mothers who are infected at the time of delivery, partners or individuals living in close household contact with an infected person, individuals with multiple sex partners past or present. Prevention strategies. The hepatitis B vaccine is a mainstay of hepatitis B infection. In addition to vaccination, there are other simple ways to help stop the spread of hepatitis B, some of which are: wash your hands thoroughly after any potential exposure, practice safe sex with all partners, avoid direct contact with blood and bodily fluids, clean up blood spills with a fresh diluted bleach solution, and cover all cuts carefully. Prevention strategies continued: avoid sharing sharp items such as razors, nail clippers, toothbrushes, earrings. Avoid illegal street drugs. Do not donate blood or body organs. Management of hepatitis B. The risk of developing a chronic hepatitis B infection is directly related to the age at which one becomes infected with the virus, as I said earlier. 90% of exposed infants will develop chronic infections, 30 to 50% of exposed children will develop chronic infections, and 10% of exposed adults will develop chronic infections. The case management. The primary treatment goals for patients with hepatitis B infections are to prevent progression of the disease, particularly to cirrhosis, liver failure, or hepatocellular carcinoma. This is a kind of liver cancer. To stop the further spread of this disease, vigilant screening of high-risk groups and compliance with universal vaccination recommendations is essential. There is a simple blood test and a safe vaccine for hepatitis B. Thank you very much.